Talking about a big issue in women, COPD or chronic obstructive pulmonary disease. We've got Dave Brickey here with Trinity Mother Francis Health Systems here in East Texas. And Dave, it's great to have you here to talk about this issue. And I was telling you in our commercial break, it seems like especially during the nightly news broadcasts on all networks here, you see a lot of commercials talking about COPD and asking a physician. So firstly, what exactly is COPD?
Well, COPD is a combination of two diseases. One's called chronic bronchitis. The chronic bronchitis patient has a productive cough, usually for 3 months, for 2 years, and that's due to overproduction of mucus in the lungs. The other part, or other half of that disease state is called emphysema, and that's the one we kind of gets everyone's phrase, I don't want to have emphysema. That's actually the breakdown of lung tissue. If we look at COPD or chronic obstructive pulmonary disease, most patients, especially women and men, have a combination of those two different disease states.
So what are some traits women should be looking for, Dave, if they feel like they might be predisposed to having COPD?
Well, the first thing is, are they predisposed? In other words, could there be a family history, which is only about 2%, called alpha-1 antitrypsin, so definitely the minority. The other one is, are you prone to it? Have you been around secondhand smoke? Have you been a primary smoker? But mainly it's kind of an insidious. It doesn't come up overnight. It comes up over several weeks to years or months to years. And are you short of breath? Do you have a cough? Those type of things.
You mentioned the difference between first-hand, second-hand smoke. So technically, I'm guessing with COPD, someone could smoke their entire life, maybe never come down with COPD. Someone could be around second-hand smoke for several months or several years and come down with COPD.
It could be. There's not a guarantee that if you smoke you will get this, and it seems like everyone knows, well, I know someone who smoked who didn't get it. But that's definitely not the common presentation. It's typically someone who's been growing up in the 50s and 60s and now 70s, who's been around secondhand smoke from parents or from family. And then you see also the kind of onset of marketing to women in the 70s, where here, take the Virginia Slims, to name a brand, and say, here, you'll feel more mature. What you find is that's why that disease now is more common in women than it has been in the past. About 14 million people are diagnosed with COPD. Roughly about 7 of those are women, and it's thought that there's probably another 10 million out there who really have the disease who aren't diagnosed.
Well, Dave, what about our baby boomer generation? As they continue to retire, get a little bit older, do you think the cases of COPD will just rise here in the coming years?
We see a disease lag. So if we look at someone in the 70s who started some bad habits like tobacco use, you'll find that even if they would stop, there's been some damage done there, and we'll see that lag, and that lag in COPD, that lag in lung cancer, will go on for another 10 or 20 years.
Now, if you've been diagnosed with COPD, if someone has been diagnosed with that, what's the first thing that they should be doing? Or what would a doctor prescribe?
Well, the first thing you have to do is look and see why and get away from that, because it may have a disease like we talked about. You want to get rid of that inciting problem, get rid of the tobacco, get rid of the secondhand smoke. Women are more predisposed from things they can't get away with. They're put together different. The airways are narrow, as well as they break down nicotine and things differently. But there are some medicines, there are very effective medicines to help dilate or open up the lungs and decrease that mucus production.
So this medication and these treatments, can they almost reverse the effects, Dave, or once the damage is done, are you pretty much just trying to keep it at bay and prevent it from getting worse?
Well, they're not going to reverse the trend. And what you're going to find is we're kind of, the way we're put together, we start losing lung function in our 30s, and then you compound that by exponential loss, in other words, by having the cigarettes and the others. But the medicines themselves can make a difference on relieving the symptoms. And that's what we need to look at, because think about if you're not able to breathe, you're not able to do things, that affects your employment opportunities and others. So it crosses over. The other part we think about, we're talking about lungs today, is there's a lot more tobacco, such as the heart, such as the body itself. So lungs, although get a lot of attention, it helps overall if you just stop smoking.
Well, Dave, if some of our viewers today, some of our women feel like they may have COPD, just want to get a test done, what's the easiest way for them to get checked out?
The best thing is having a good primary care physician. Talk to their primary care doctor, and don't feel that they're being wimpy or complaining. Say, I think I'm short of breath, and just like we look at blood tests for diabetes and others, we can do something called a spirometry, which is a very basic oxygen flow, or a very basic lung flow measurement, where we can say, are your lungs normal or aren't they? And that's also good to have, because we'll say, well, what if it's normal this year, and a few years from now it's not? So we can actually have a comparison on the patient.
Okay, Dave, some great information here today regarding COPD. It's great to meet you and have you on our podcast
here
this morning. Absolutely, Dave. Come back anytime.
Thank you.